Our presidential candidates are offering their own proposals to your health, elaborate plans for how to improve America's healthcare system. We saw a little earlier what France does in this regard for her citizens. Now, what changes can Americans look forward to, particularly those not insured? Our cover story is reported now by Rita Braver.
Welcome to Signy's. We're known for our French toast, blueberry, blackberry, or plain.
At Signy's Heaven-Bound Bakery and Cafe on Hilton Head Island in South Carolina, everything is made from scratch.
And we can see the cake being made right here. It definitely is made by hand.
And it's with butter. Butter, sugar, eggs. No boxes, no mixes, no buckets.
This is my fresh Greek salad.
The dozen or so employees who work here pride themselves on the food they turn out. But customers are blissfully unaware of something that troubles owner Signy Gardo.
Are you able to provide health insurance for your employees here?
No.
Gardo, who at age 67 is herself covered by Medicare, once did offer insurance. But now she says, like some 40% of all small business owners, she just can't afford it.
Recently I costed it out. It could go as high as $70,000 for me. It's a matter of where do I appropriate the money? It's not coming, through the door.
There are now about 46 million Americans without coverage. The folks who work at the Heaven-Bound Cafe have been lucky. None of them has faced a health care crisis yet.
You never think that something like this would happen.
But if you wonder what it's like to be seriously ill and have no health insurance, travel a few miles down the road and meet 48-year-old Sharon McGovern. Last year, she was diagnosed with an aggressive type of cancer, follicular lymphoma.
I was panicking. I didn't know what to do. Some people with this disease can wait and watch, some people can't. And I just knew in myself that I could not.
McGovern had reason to be scared. In 1998, her then 32-year-old husband succumbed to liver cancer after he put off getting treatment because his construction job offered no health insurance.
And how long between when he was diagnosed and when he passed away?
6 weeks.
Sharon was raising their son alone. She'd found a job with health insurance and was doing fine until she was laid off. She could have continued her old insurance by buying a temporary bridge plan, but there was a problem.
If you had paid for what the health insurance was costing, could you have afforded to keep paying your mortgage?
No, I couldn't. I could not. We couldn't have afforded hardly anything at that point.
Before she could start a new job, her cancer was detected.
My greatest fear is, what's going to happen? I'm by myself. I have my child to take care of.
At least 22,000 uninsured Americans die each year because they can't get care. And without insurance, Sharon McGovern was turned away by several doctors. Her life was saved because she came here, to the Medical University of South Carolina.
They were able to get you into a clinical trial of a drug.
Yes.
She wasn't just sick, she was dying sick. And somebody has to take care of the patients when that happens.
Somebody, says Dr. Jack Feusner, chairman of the Department of Medicine, usually turns out to be a nonprofit hospital like this one.
Our charity care has escalated in a frightening way to $80 to $100 million. We are getting to the point where this is threatening our fiscal solvency.
Hold this on your tongue for me. You hold this under your tongue?
It's not just here. In 2006, American hospitals provided $3.2 billion worth of unpaid care. And patients like Chris Fleming, who works full-time for a property management company, still flock to emergency rooms all across the country.
Has your work ever offered you any health insurance?
No, they have not.
They haven't?
No.
Okay.
While the truly indigent are entitled to free insurance through Medicaid benefits, and the elderly get Medicare, low-wage earners often turn up here because under the law, hospitals must provide emergency room services for all patients. But who really ends up paying for the uninsured? All of us.
Maybe the standard amount that you charge a person with health insurance is a little bit higher.
Correct.
To make up for all the uninsured?
Correct. The patients with health insurance probably pay disproportionately more than they might if everybody was insured.
The two presidential candidates have radically different approaches to the health insurance crisis. Senator John McCain says it's time to move away from employer-based care.
But I want to give every American family a $5,000 refundable tax credit. Take it and get anywhere in America the health care that you wish.
As a trade-off, McCain would tax, for the first time, employer-provided health insurance policies, which average about $12,000 annually for a family.
The practical effect of the changes in the tax system that he's talking about are going to decrease employer-sponsored insurance.
That's because, according to Linda Blumberg of the nonpartisan Urban Institute Health Policy Center, young, healthy people will be able to find cheaper coverage on the open market than at work, and employers may no longer feel obligated to offer group insurance for everyone else.
The McCain plan, I think, would actually hurt people who have health conditions and people who are older because they would not fare as well obtaining health insurance coverage away from their employers.
For the highest risk patients like Sharon McGovern, McCain says he would get states to subsidize special insurance pools called guaranteed access plans. How they would be funded is unclear. As for Senator Barack Obama,
if you've got health insurance through your employer, you can keep your health insurance, keep your choice of doctor, keep your plan.
he wants to build on the current employer-based system, subsidizing small businesses that can't afford insurance. He would also create large insurance pools to sell affordable coverage to the uninsured, including those with severe health problems like Sharon. Larger businesses that don't offer employee health insurance would be required to pay in. Health policy groups estimate that while many more of the uninsured would be covered under Obama's plan, it would be more expensive.
The Obama plan just sounds like it's going to end up costing taxpayers so much money.
Well, there is potential for big increases in spending if we're not careful about also putting a serious emphasis on cost containment.
Today, more than half of all personal bankruptcies are due in part to health care expenses. It has not come to that yet for Sharon McGovern, though she did lose her house and doesn't know what she will do if her cancer goes out of remission.
It's so scary, because I don't know what's going to happen.
What's more, she worries that no matter who wins the election, health care reform will become a low priority again.
And that's one of my greatest concerns, is that it will get shoved under the rug because of the way the economy is right now.
And Dr. Feusner says hospitals like his have no choice but to keep trying to provide the best treatment possible for the uninsured, even as funds are harder to find.
And what happens if we reach the breaking point and we can't?
What happens?
Do I hope one of these candidates will become president, help with this? Yes, I do. I hope that they will do enough. If they don't do everything, that they will do enough so that we don't have to look into that abyss.
Bag of saline and tubing, please.
I don't know what the answer is, but it should not be this way. And how can we as an American people let people walk away or die because they can't afford health insurance?